And then, this is something that maybe this will be helpful. This is something else that is a good kind of tip. And that is that, and Chantel, I'm sure you probably have a really complex organizational system for Liam, and maybe even Luke too. I think kind of all parents could benefit from this, quite frankly. But you're just getting so much documentation, and it's like, what do you do with it? When I first started in my training, we were often encouraging parents to make these physical binders and really keep everything, kind of keeping hard copies really, really organized. And a lot of parents still do that. Parents will come in my office with like a huge binder and just like put it down on the desk, and I'll have to sift through it and kind of take from it what I think I might need. But a lot of my patients have some sort of electronic organization at this point. A lot of them use Dropbox really successfully. And again, when we're talking, coming back full circle to this conversation about care collaboration, if you have something like a Dropbox file, that can actually be shared across providers. So, there's a lot of push now to have more standardized electronic medical records, right? But we're not there yet. Hopefully we're moving in that direction. And that would be kind of the gold standard, right? But I think until then, what I've received from a lot of parents are kind of links to access their Dropbox file, and that has everything in there organized. And it's easy for parents. It makes communication really, really pretty streamlined, and you're really just making sure that, again, everyone in the team is all on the same page. What's also helpful to have maybe in this, physical binder or this Dropbox would be a couple different kind of tracking sheets or lists. So it could be, appointment logs, all of the appointments that individual has had related to their autism or ADHD within the past year. Medication lists that you can just really, sometimes when medications can be hard to pronounce, or they can be really difficult to keep track of, parents can just kind of have that really quick to send, either hard copy, or they can take a picture of it, or they can just copy and paste it from their electronic file and make sure that everyone has their most recent medication list. Also a list of medical providers. So Chantal, when you talk about everyone on your team, as Liam ages, his team will probably even just grow more. People probably won't be dropping off too much. And so it can be really helpful to have all of that in one place.